Hello, and welcome to today's live session on understanding and managing anxiety in children, signs, causes, and practical tips for parents. I'm Diana, and over the next hour, we'll be diving deep into a topic that's crucial for every parent: how to recognize, understand, and effectively manage anxiety in children. If you're joining us live, please introduce yourself in the chat. Tell us where you're watching from, and also feel free to ask questions in the chat. I'll do my best to address them throughout this session. So, this topic is important because anxiety is more common in children than many realize. But with the right knowledge and strategies, you can support your child and help them navigate these challenges. Oh, I think it's much better without the light. Oh, yeah. I think I prefer it this way without the light. Anyway, we're going to crack on. Like I said, if you're joining us live, please introduce yourself in the chat. Tell us where you're watching from, and also feel free to ask any questions you have. Just pop them in the chat box, and I'll do my best to address them throughout the session. So, we're going to start with a definition of anxiety. So, what is anxiety? It's a very common term. I'm sure it's something you hear all the time. So, let's start with a basic understanding of what anxiety is and how it manifests in children. Now, anxiety manifests in adults as well, but for the purpose of this live, we're going to be talking about anxiety in children. So let's start with a basic understanding of anxiety and how it manifests in children. We're also going to discuss the difference between normal fears and anxiety disorders. Now, anxiety is a natural emotional response to perceived threats or stressors. It's characterized by feelings of worry, nervousness, or fear about future events or situations. While everyone experiences anxiety from time to time, it becomes problematic when these feelings are intense, they are persistent, and they interfere with daily life. Now, in children, anxiety can manifest in a variety of ways, both physically and emotionally. And unlike adults, children may not always recognize or be able to articulate their feelings of anxiety. So it often shows up in their behavior. Now, signs of anxiety in children. To recognize the signs of anxiety in your child is the first step. We're going to be covering the common physical, emotional, behavioral, and social signs of anxiety in children. Now, for physical symptoms, these include stomach aches, headaches, or other unexplained physical complaints. Another physical symptom is restlessness or fidgeting. Um, Sleep disturbances such as difficulty falling asleep, nightmares, or waking up frequently is another physical symptom of anxiety in children. Fatigue or tiredness despite getting enough sleep, and then rapid heartbeats, sweating, or shortness of breath. Now we're going to be going on to the emotional and behavioral symptoms of anxiety in children. These include excessive worrying about future events, performance, or social situations. You find that a child is very irritable, they've got mood swings, or they've got frequent bouts of crying. Anxiety can also manifest in clinginess or seeking constant reassurance from parents or caregivers. In children, anxiety can also manifest in avoidance of activities, people, or places that trigger their anxiety. It could also manifest in difficulty concentrating or being easily distracted. Anxiety can also manifest socially. So, some of the social symptoms include reluctance or refusal to go to school, avoidance of social interactions or activities with peers, fear of being away from parents, so separation anxiety. Now, um, some of these fears can be normal, but there's a difference between normal fears and anxiety disorders, and it's important to differentiate them because normal fears are a typical part of childhood development, but anxiety disorders require attention and possibly intervention. So now, let's see if we can differentiate between normal fears and anxiety disorders. Now, for normal fears, most children experience fears at certain stages of development. So it could be something like fear of the dark, it could be something like fear of strangers, or just fear of being away from their parents. Now, these fears are usually temporary and resolve on their own as the child begins to grow and gain more experience and confidence. Now, normal fears don't significantly interfere with the child's ability to function in daily activities like school, play, or sleep. Now, anxiety disorders, on the other hand, are more intense and persistent than normal fears. So they often cause significant distress, and then they impair the child's ability to function in various areas of their lives. Unlike normal fears, anxiety disorders don't fade away on their own, and they can persist for months or years if they are not addressed. Um, so there are types of anxiety disorders in children that you may have heard. This includes generalized anxiety disorder. It could be social anxiety disorder. It could be separation anxiety, and it could be specific phobias. So specific phobias, fear of the dark, or such kind of phobias. Now, children with anxiety disorders may require professional support, such as therapy or counseling, to manage their symptoms and develop coping strategies. Now, like I said, while normal fears are a common and temporary part of childhood, anxiety disorders are more severe and long lasting and may potentially require professional intervention to help the child manage their anxiety effectively. So, let's go on to talk about the common causes of anxiety in children. Now, this can be triggered by a variety of factors. For the purpose of this session, we're going to talk about genetic predispositions. We're going to talk about environmental stressors such as family issues or pressure at school. And then we're also going to talk about major life changes such as moving, relocation, or divorce. Now, it's essential that you understand these triggers so that you can better support your child. So, for genetic predispositions, genetic factors can play a significant role in the development of anxiety in children. So, if a child has a family history of anxiety disorders or other mental health conditions, they may be more predisposed to experiencing anxiety themselves. This is because certain genes associated with the regulation of mood, stress responses, and neurotransmitter function can be inherited. Now, while genetics alone don't determine whether a child will develop an anxiety disorder, it can increase the likelihood, particularly when it's combined with environmental stressors. Now, for environmental stressors, environmental factors often contribute to the onset and the exacerbation of anxiety in children. So, for anxiety to get worse. Now, some common environmental stressors include family issues. Now, children are sensitive to the dynamics within their home. So, high levels of parental conflict, inconsistent or overly harsh discipline, or a lack of emotional support can lead to anxiety in children. So, children may often begin to worry about the stability of their family or feel insecure about their relationships with, their family members or even their caregivers. Now, another environmental stressor that could contribute to the onset of anxiety or the worsening of anxiety in children is pressure, school pressure, pressure at school. Now, academic demands at school, as well as the social challenges at school, can be a significant source of stress for children. So, pressure to perform well academically is one of them. Fear of failure, bullying, or even difficulty fitting in with peers at school can all contribute to feelings of anxiety. In some cases, the fear may be the fear of being judged or criticized by teachers or classmates, and this may lead to school related anxiety, including refusal to attend school. Now, another environmental cause stressor that can lead to anxiety in children is major life changes. So, major life changes can be particularly challenging for children. It often triggers or worsens their anxiety. Now, as you may well know, children thrive on routine and predictability. So, significant disruptions to these routines and predictable, things that they do can cause them to feel insecure and anxious. So, some of these major life changes that can lead to anxiety include moving or relocating to a new home, especially if it involves changing schools or moving to a different city or country. This can be a major source of stress for children. So they may worry about leaving their old friends and making new friends. They may worry about adapting to the new environment. They've obviously lost touch with their old friends and their familiar surroundings, and they're moving to a completely different environment. Another of these major life changes could be divorce or separation. So when parents go through a divorce or separation, it can have a profound impact on a child's emotional well-being. The children often may feel caught in the middle. They might worry about losing a parent. They might fear changes in their living arrangements. This uncertainty and the potential conflicts that happen during and after the divorce process can lead to heightened anxiety in children. Moving on, another major life change that can, you know, cause the onset or worsening of anxiety in children is the loss of a loved one. Now, the death of a family member or a friend or even their pet, it can be a traumatic experience for a child. So it might lead to anxiety about death, loss, or abandonment. Um, Even as adults, you know that how grief affects us. Talk more of children. Now, grieving children may become anxious about their own mortality or the potential loss of other loved ones. And based on all of this, it's clear that anxiety in children often stems from a combination of genetic predispositions and environmental factors. Now, while some children may be more naturally inclined towards anxiety due to their genetic makeup or stressors in their environment, such as family issues, school pressure, and major life changes, like we've earlier mentioned, these stressors or a combination of that can significantly impact their mental health. Now, understanding these causes is crucial for parents and caregivers in order to be able to provide them appropriate support and intervention. So, before we go into the role of parenting in managing anxiety, um, like I said, if you join in the chat, please introduce yourself and let us know where you're watching from. And if you've got any questions, please pop them in the chat box and I'll do my best to answer them throughout the session. So let's move on to the role of parenting in managing anxiety. Now, as parents, we obviously can't control every factor. There are ways to minimize anxiety inducing environments at home. Yes, we can't control it, but we can minimize, the things that induce anxiety, that cause anxiety at home. And in this under this section, I'm going to be discussing the importance of a stable and supportive home environment. I'm also going to be talking about setting realistic expectations for our children and providing reassurance. And then I'll also talk about the importance of encouraging open communication. Now, for is the importance of a stable and supportive home environment, this is really crucial for reducing anxiety in children. Stability provides a sense of security and predictability, and this helps children feel safe and less anxious. So, the question comes, how can parents create such an environment? The first thing we can do is to make sure that we provide consistent routines for the children. So, maintaining consistent daily routines for meals, for homework, for playtime, for bedtime, it can provide a sense of structure and normalcy for the children. When children know what to expect and at what time to expect it, they are less likely to feel overwhelmed by uncertainty. Another way we can provide a stable environment for them is to provide them with emotional support. Children need a nurturing atmosphere where they feel loved and valued. This is really essential. So, parents need to regularly express affection, praise their child's efforts, and be attentive to their emotional needs. Knowing that they have a reliable support system at home can significantly reduce a child's anxiety. Another way we can provide them with a safe and supportive environment is to create a safe space for expression. It's important that children have a safe space to express their emotions without fear of judgment or punishment. This encourages them to share their feelings and experiences, which can help alleviate anxiety before it becomes overwhelming. So it's really crucial. This is one very important one. Make sure that you create a safe space for expression. Children need to feel like they can say what they want to say without fear of judgment, without fear that they're going to be punished, you know. And it's important, especially as they begin to grow up, you'll find that that safe space for expression will be a benefit, because at every point in time you will be aware of what's going on with them, and it helps you to guide them appropriately as well. Now, for setting realistic expectations and providing reassurance, Unrealistic expectations or constant pressure to achieve can contribute to a child's anxiety. While as parents, it's we all want our children to achieve, to be high achievers, to be high flyers. It's vital for us to set realistic goals and offer reassurance rather than placing undue stress on the child or on our children. So our expectations should be balanced. Parents should try to set goals and expectations that are appropriate for their child's age and abilities. While some children will excel academically, some other children will excel in the arts. They will excel in sports. They will excel in other areas. So it doesn't have to be just academic expectations. You know, all children are not going to be are not going to be up there. They're not all going to have straight A's. So set goals and expectations that are appropriate for your child's age and for their abilities. Avoid comparing the child to others, as this can lead to feelings of inadequacy. Instead, focus on the child's individual progress and celebrate their unique strengths and accomplishments. Another way we can do this is to encourage effort and not perfection. So, it's important that we emphasize the value of effort and learning rather than perfection. So, it's important that we let our children know that making mistakes is a natural part of growth, and that we reassure them that they are loved and accepted regardless of their performance. This is really, really, really crucial. If you don't take anything away from this live session, please take this. Reassure your children, make them know that they would be loved and they are loved and accepted regardless of their performance. Another one is regular reassurance. Anxiety often stems from fear of the unknown or fear of failure. So, as parents, we can reduce this anxiety by providing regular reassurance. So, for example, let's say your child has a big test or a new experience coming up. Remind your child that it's okay to be nervous, that you believe in their abilities, and that you're there to support them no matter the outcome. Now, moving on, encouraging open communication. Communication is key to understanding and addressing a child's anxiety. It is really, really, really key. When children feel comfortable talking about their worries, parents can offer guidance and support more effectively. So, one question that would come at the back of your mind right now is, how do you encourage open communication? One of the ways you can do that is by active listening. So, as parents, practice active listening, which means that you're giving full attention to that child when they speak without interrupting or immediately trying to offer solutions. So, this shows the child that their feelings are important and that they are being heard. Another way that you can encourage open communication is by creating an open dialogue. So, encourage your child to talk about their day, talk about their feelings, talk about any concerns that they may have. Ask open ended questions that prompt them to share more about their experiences and emotions. For instance, they come back from school. Instead of asking, "Did you have a good day?" you could ask, "What was the best part of your day?" And what was the hardest part of your day? This will help them to talk about, prompt them to share more about their experiences and their emotions rather than, "Did you have a good day?" The answer is yes or no. And most children, especially if they find that they are not in an environment where they're able to speak about how they feel, they'll just say yes, and that is it. But when you ask open ended questions, it prompts them to share more about their experiences, and that really helps to reduce anxiety. Another way we can encourage open communication is by validating the feelings of our children. It's important to validate your child's feelings, even if their worries seem really small or irrational. Acknowledging their emotions helps them to feel understood, and it also helps them to feel less alone in their anxiety. One way you can do this is, when they tell you about those seemingly small or irrational things, you might say, I can see that you're really worried about this. It's okay to feel this way, and I'm here to help you through it. That really helps validate a child's feelings. Another way you can encourage open communication is by modeling healthy communication. As children, it's often said that children learn more by what they see than what you tell them. So, as parents, we can model how to express our emotions and cope with stress. So, by showing your child how you manage your own anxiety or stress in healthy ways, you're teaching them valuable coping strategies that they can use themselves. So by focusing on all these strategies, creating a stable, supportive environment, setting realistic expectations, and encouraging open communication, as parents, we can significantly reduce the anxiety-inducing factors at home. Now, this will not only help to alleviate your child's anxiety, but it also equips them with tools to manage stress and challenges in the future. So, it will also help them to develop coping strategies that will help them to build resilience. And that resilience is going to be a well of strength that they can draw from in their lives as they grow up and in the future as well. So before we move on to when you can seek professional help for your child, let me check the chat box. So hi Olawefa, hi. Thank you for joining. Thank you so much. Interesting. Thank you so much for your feedback. Um, Once again, if you're joining live, please make sure that you introduce yourself in the chat. And also, as you listen, if you've got any question, please pop it in the chat box and I'll do my best to answer throughout the session. Thank you so much for joining. I appreciate your support. All right, so let's go on to when to seek professional help. Now, many of these strategies that I have mentioned can be employed at home to help manage a child's anxiety. But there are situations where professional help becomes essential. Now, knowing when to seek professional assistance can make a significant difference in a child's mental health and overall well being. So, let's take a closer look at when to consider therapy and then the types of mental health professionals who can provide the necessary support that we would need for our child who may be suffering anxiety. So, one of the signs that it is time to seek professional help, there are actually several indicators that a child's anxiety may require more than just these home based strategies. And the very first one is persistent and severe symptoms. Now, if your child's anxiety persists for an extended period, so this is typically like several weeks or months, and then despite your best efforts to alleviate it, there is no change, this may be a sign that professional help is needed. Um, so, severe anxiety that interferes with daily activities such as going to school, participating in social activities, or maintaining relationships also warrants attention. So, another indicator is the physical health impact of the anxiety. Now, yeah, we know we did say earlier that anxiety can manifest physically. However, if it manifests physically, leading to frequent headaches, stomach aches, fatigue, or other unexplained health issues, and your child is regularly experiencing these physical symptoms with no clear medical cause, this could be a sign of underlying anxiety that needs professional intervention. Another of these indicators is avoidance and withdrawal. So let's say your child begins avoiding situations or activities that they previously enjoyed, or becomes increasingly withdrawn. It could be due to anxiety. And one of the things is this avoidance, it can lead to missed opportunities for social development, and it can also lead to increased isolation, which makes professional help really, really crucial. The fourth one, so we've talked about the first one we did say was persistent and severe symptoms. The second we said is physical health impact. The third is avoidance and withdrawal. So the fourth one is behavioral changes. So significant um, changes in behavior, such as increased irritability, frequent outbursts of anger, frequent crying, especially if these behaviors are new or they are beginning to escalate. This might indicate that the child is struggling with anxiety that is beyond their ability to manage. Remember, in the first part of this session, I did say that as adults, we're able to manage our anxiety better than children, because children are not able to verbalize, really, really articulate and verbalize how they are feeling. So once these significant changes in behavior are new or they're beginning to escalate, it's an indication that the child is struggling with anxiety that is beyond their ability to manage or beyond their ability to articulate. The fifth one is impact on their academic performance. So if your child's anxiety is beginning to affect their ability to concentrate at school, if it's beginning to, even at home, not just at school, if it's beginning to affect the ability to complete schoolwork or attend school regularly, it's important to seek professional help. Anxiety can significantly impact a child's academic performance and self esteem if it is not addressed. Then the sixth one is safety concerns. So in severe cases, anxiety can lead to thoughts of self-harm. Children will begin to have negative thoughts. They want to harm themselves. They want to hurt themselves. If your child experiences any of these thoughts, they think about harming themselves or they think about harming others, immediate professional intervention is necessary. In this case, it's a mental health emergency, and you need to seek help right away. You need to seek help right away. So the type of mental health professionals who can assist if your child is suffering anxiety, when it becomes clear that professional help is needed, there are several types of mental health professionals who can provide the kind of support that is appropriate for them. The first one is pediatricians or family doctors. This is often a good starting point. Your child's pediatrician or family doctor can perform an initial assessment to rule out any physical causes of for your child's symptoms, and they can also provide referrals to mental health specialists if needed. The second group of mental health professionals who can assist is child psychologists. So these child psychologists are usually trained to diagnose and treat anxiety disorders in children. So not just anxiety disorders, other mental health illnesses or conditions in children. And what they do is they often use therapeutic approaches such as cognitive behavioral therapy, that's CBT, and which helps children to recognize and change their negative thoughts patterns and behaviors. CBT is one of the most effective, therapies in treating anxiety disorders in children, as it can equip them with coping skills to manage their anxiety. The third group of people that can help if your child is experiencing anxiety are child and adolescent psychiatrists. So, psychiatrists are medical doctors who specialize in mental health, And child and adolescent psychiatrists can diagnose anxiety disorders and other mental health conditions. Now, where necessary, they are also able to prescribe medication that can help. Now, medication can be considered when anxiety is severe and significantly impairs a child's daily functioning, or in situations where therapy alone is not sufficient. And we also have licensed clinical social workers and counselors that can help in providing therapy and support for children dealing with anxiety. These people, these licensed clinical social workers and counselors, they work closely with families to develop strategies for managing the child's anxiety and improving the child's emotional well-being. They often use a variety of therapeutic techniques. This may include things like play therapy for younger children to help them express and process their emotions. Now, depending on the part of the world where you are, another group of people could be school counselors and psychologists. These school counselors and psychologists can offer support within the school environment, so within their education and educational environment. They can help identify anxiety issues. They can help provide counseling. They can help collaborate with teachers to create an accommodating and supportive school environment. They are also a valuable resource for connecting families with outside mental health services. So it's important that you take advantage of any of these groups of people, depending on what is available to you, um, to get professional help for a child whose anxiety has become severe. So, to recap, pediatricians or family doctors, we've got child psychologists, we've got child and adolescent psychiatrists, we've got licensed clinical social workers and counselors, and then we've got school counselors and psychologists. Now, the role of therapy in managing anxiety for children, um, therapy is often a critical component in managing childhood anxiety, especially when it is beyond what can be managed at home by the parents. Now, what therapy does is that it provides a safe space for children to explore their feelings. It provides a safe space for children to learn coping strategies. And also, it provides a safe space for children to develop resilience. Now, some of the common therapeutic approaches include CBT, like I mentioned, so that's cognitive behavioral therapy. Um, it's widely used and is an effective treatment for anxiety. What it does is it helps children understand the connection between their thoughts, their feelings, and their behaviors. And it also teaches them how to challenge and change their unhelpful thought patterns. Um, Another common therapeutic approach that I mentioned earlier was play therapy. This is especially useful for younger children as it allows them to express their emotions through play, which can be a more natural form of communication for them. So, what this approach does is that it helps therapists to understand the child's emotional states and also to guide them towards managing their anxiety. Another common therapeutic approach is family therapy. So, if you recall, I did mention that sometimes anxiety in children is closely linked to family dynamics. So, family therapy would involve the whole family in treatment. It will help to address any underlying issues within the family that might be contributing to the child's anxiety, and it will help improve the overall family communication and functioning. Now, this is really important because Like I said, sometimes the dynamics in the family can cause anxiety in children. And like we all know, children are not able to articulate their thoughts, they are not able to express themselves, especially when they find themselves in families where there's no open communication. So, family therapy is a very important one, especially if the anxiety has to do with the family dynamics. If it's linked to the family dynamics, family therapy is a very good therapeutic approach that can help to deal with the anxiety in the child. Now, while many children will benefit from these supportive strategies at home, the ones I mentioned at home, professional help is essential when the anxiety becomes severe, becomes persistent, or it interferes significantly with daily life. So, recognizing when to seek help and understanding the types of professionals available can ensure that your child receives the care that they need to manage their anxiety and to thrive. Um, yeah. So, hi, Justina. This is Justina watching from Canada. Hi, Okorite, watching from Glasgow. Thank you so much. Thank you so much for watching. Um, thank you. You have missed a whole part. If you're just joining us, you've missed a whole lot. But yeah, the video will be available to watch as a replay, so you can always go back to watch it. Today, we're talking about understanding anxiety in children. So we've talked about what the definition of anxiety is. We've talked about the causes of anxiety. We've talked about the common signs of anxiety. We've talked about some strategies that you can employ at home as a parent to make sure that the environment, you provide a safe and supportive environment for your children to reduce their anxiety. Um, some of the strategies that you can use, some of the practical tips that you can use, which I haven't mentioned, are things like mindfulness and relaxation techniques. So it could just be simple breathing exercises. If you find that your child is anxious, you could just tell them to breathe. It could be simple things like meditation, using grounding techniques. It could just be positive in reinforcement, like I've said, encouraging small victories and gradually exposing them to anxiety triggers in a controlled way. So if you've learned that, for instance, darkness is a trigger, is one of the child's phobias or one of the triggers for your child developing anxiety, you can just begin to expose them to those triggers in a controlled way and encourage small victories, as they make progress. And we also talked about how to create a predictable environment to reduce anxiety and stress. We've talked about um, when anxiety becomes severe and when to know that your child needs help, when your child needs professional help. So, the indicators that show that a child's anxiety may require more than just the home based strategies. We've talked about the role of therapy and the different types of therapy that can help. Um, and yeah, we can answer your questions now if you've got any. I'll now take some time to answer any questions that you have. I haven't seen any question in the chat box yet. I haven't seen any questions yet in the chat box. Justina says this is really helpful. Thank you so much. Thank you so much, Justina. I really appreciate you coming on this live. Thank you very much. I'm available to take your questions. If you've got any questions, please feel free to drop them in the chat. Um, I appreciate you joining today's session. Um, One of the takeaways from this session should be that you should remember that recognizing and addressing anxiety early can make a significant difference in the life of your child or any child at all who is suffering anxiety. Um, so let's see if we can get any questions. Did you understand? Did you understand the session? Do you have any questions for me? If you've got any questions, please pop them in the chat box. Um, if there are no questions, let me see if I can do like a brief recap again of what we've covered for the benefit of uh, those who joined us late. Let's see if there's any questions yet. Nothing. No questions for me. Okay, let me see if I can use the remaining. We've got about 13 minutes on the clock. Let's see if I can use the remaining time to like do a bit of a recap of what we've done today. So today's session was about is about understanding and managing anxiety in children, signs, causes, and practical tips for parents. So we said anxiety is more common in children than many realize. Um, if you did watch my recent video about the common mental health myths, if you haven't watched it, please do watch it after this end at the end of this live. So one of the common myths of mental health is that children don't experience any mental health conditions, and that is incredibly harmful. Is really harmful because like children can and do experience mental health issues, and for us to be able to help them, we need to recognize it early. So anxiety is more common in children than a lot of us realize, but with the right knowledge and strategies, which I believe you would have gotten from this video, you can support your child and you can help them to navigate these challenges. We defined anxiety, we defined anxiety, and we talked about how it manifests in children. We discussed the difference between normal fears and anxiety disorders. So anxiety can be normal, it can be normal, but when it is severe and persistent and lasts for a really long time, then it's no longer normal. It becomes an anxiety disorder or a mental health condition. We talked about the signs of anxiety, and we said recognizing these signs in your child is the first step. We covered the common physical, emotional, and behavioral signs, such as physical symptoms like stomach aches, sleep disturbances. We talked about excessive worrying. We talked about avoidance of social situations and activities. We also talked about the common causes of anxiety in children, which we said can be triggered by a variety of factors such as genetic predispositions, environmental stressors such as family issues and pressure at school. Another major cause of anxiety is life changes like moving or divorce. And we did say that it's essential to understand these triggers so that you are better able to support your child. We then went on to talk about the role of parenting in managing anxiety. We did say that while as parents we can't control every factor, there are ways to minimize the anxiety inducing environments at home. So we mentioned the importance of a stable and supportive home environment. We also talked about setting realistic expectations and providing reassurance. We talked about encouraging open communication. And then we talked about the practical tips that you can use to manage your child's anxiety, which include mindfulness and relaxation techniques, routine and consistency, as well as positive reinforcement. Um, then we covered when to seek professional help. So we said many of the strategies that we mentioned can be implemented at home. However, sometimes professional help is necessary. And so we talked about when to consider therapy and the types of mental health professionals that can assist when you need to get professional help for your child. So, yeah, Okorite says you've answered all my questions. Very insightful, much appreciated. Thank you so much. I appreciate you too, Okorite. Thank you for joining the live. Um, okay, hi. If you're just joining us, can you tell us where you're watching from, please? Introduce yourself and tell us where you're watching from. We're almost at the end. We've just got less than 10 minutes on the clock, and it doesn't seem like we're getting any questions. So I might have done a good job. I might have done a really good job with answering all your questions since you don't have any. Did you think I did a good job? If you did, let me know in the chat box, please. Yes, great job. Oh, yeah. Thank you. Thank you. Thank you, Okarita. Thanks. So, for my final thoughts, I appreciate every single one of you for joining today's session on understanding and managing anxiety in children. Um, I want you to remember that recognizing and addressing anxiety early can make a significant difference in your child's life. If you found this video helpful, as always, please like, please share, and um, yeah, share. Please share. That's very important because lots of people need to hear this. Lots of people need to learn this. And then, if you would like more content on mental health awareness, general health, and nursing topics, uh, it would be a good idea to subscribe if you haven't already. And make sure you turn on the bell notification so that you don't miss out on future content. Um, this is my second live on this channel, and hopefully, I'll be doing at least one or two lives every week because I find that it's more interactive, you know, and you get to ask your questions real time, um, rather than, asking a question and then sometimes I might miss it in the comments. And yeah, before I go, this video is actually inspired by a question that was asked by one of the members of our community. So I did make a video on understanding anxiety, but what I did was it was mostly specifically for adults. Yeah, it wasn't really about children. So she did ask a question about the signs of anxiety in children, and she wanted a video on anxiety in children. And so I figured it would be nice to do it as a live session to so that it can be more elaborate, because if I wanted to do it as a video, it's going to be too long. So I figured it would be a nice topic to come on live and talk about. So in the absence of any other questions, thank you so much for watching, and I'll see you in the next live session. If you've got any suggestions on any topics you would like me to cover in the next live session, please put them in the chat box for me so that I can take note of them, and we'll probably do like a video or come back live to talk about it. So if you've got any suggestions for any videos or any topics you'd like me to cover, please pop them in the chat box. I'll take note of them, and I'll do either a normal long form video, or I'll come live to talk about it. So I hope you found this live session valuable. Um, I hope you found it valuable. I hope you got value. Yeah, I hope you got value. All right. So thank you again for joining the live session, and I'll see you in the next one. Take care. Bye.